Hi there, well here in Scotland you can feel the start of autumn coming. There is definitely a nip in the air and the leaves are starting to turn with the final hay bales being collected off the fields around us. Sheer relief for anyone suffering from hot flushes and night sweats. This week at Fountain Retreats I'm going to give you a whistle-stop tour of hormone replacement therapy, commonly known as HRT. Should you take it? Does it work? How risky is it? And when do you start taking it? These are the most common questions any woman will want to ask. Firstly, when do you know if you need HRT or not? Well, essentially, this should be a discussion you have with your experienced healthcare professional, whether that is your GP or your practice nurse or a menopausal specialist. I always say to women, if your symptoms are affecting your quality of life, then maybe that's the time when you need to have that chat. So does it work? Well, it is recommended as the first line of treatment for menopausal symptoms by any menopausal specialist out there. There are many women who have found it life-changing because it has such positive effects. There will always, of course, be a percentage of women, as with any medication, that don't find it suitable, but sometimes it can be a matter of finding the right combination for your individual physiology, with over 50 different combinations available. There's also a percentage of women who unfortunately cannot be offered HRT due to having had previous estrogen receptive cancers or some other medical issues. So to simplify for you, HRT essentially replaces the estrogen which has started to decline that is causing the majority of your symptoms. Compare it to a flat tyre. The tyre needs air to make it useful again, doesn't it? You replace the air and hey ho, all is working again. Simple, I know, but similarities with taking HRT. What is it composed of? Well, if you still have your womb, also known as uterus, then HRT consists of estrogen and progesterone. The progesterone is there to help to protect the endometrial lining of your womb. If you have had a hysterectomy, so no longer have the womb, then you can be offered estrogen on its own. There are non-hormonal medications that can be prescribed instead of HRT, but you'll find that these can maybe only help one or two of the symptoms you may be suffering from, whereas HRT helps with a whole umbrella of different symptoms and is actually replacing estrogen, so long-term helps to contribute to healthy bones and cardiovascular health. So what are the risks? Well, firstly, can I advise anybody out there not to read sensationalistic headlines on anything to do with any medical issue. Please go and seek advice or read reports written by the people who work within that particular field of speciality on a daily basis and who really know what they're talking about, but also who really care what they're talking about. There are potential risks with any medication that you take. With HRT, at the time of doing this vlog, the current research states that there's a small risk of breast cancer with certain types of HRT in 1 in 1,000 women when taking combined HRT after a period of over 5 years. What the headlines don't tell you is the current view that HRT acts as an accelerator, meaning that it's a promoter, not an initiator of the cancerous cells. However, let's put everything in perspective, shall we? If you're overweight or obese, or if you drink excessively, this will contribute so much more to the risks of developing breast cancer, which is why any menopause specialist, and here at Fountain Retreats, we encourage everyone to lead a healthy lifestyle, to eat a balanced, nutritious diet, to be well exercised, and to try and incorporate into your busy lifestyle some valuable rest and relaxation. There are alternative remedies which can be taken instead of taking HRT, but I'm going to leave those for another day. For more information on this topic, have a look at our latest blog post. Don't forget to like and subscribe to Fountain Retreats, which means you're going to stay up to date with everything we're doing here. And to book, go on to the retreat. To book onto retreat, go and click on the link in the description below. So that's all from me this week. Our topic next week is alternative remedies and therapies. And now I'm just going to go off and get changed to get all stretched out for my local Pilates class. Have a good week.